A lot of people continue to persever over the fact that, oh, if I switch to plant-based eating, don't I need to supplement my protein intake? Again, there's a significant myth out there, no doubt pushed and continued to be add to the confusion are these food companies that produce animal-based foods, which tend to be high in protein and also high in fat. So if they can convince the population through their sometimes deceptive advertising that we're all protein deficient or you're not getting enough protein, then the next logical step that somebody would have to make then is that they need, if they're going to plant-based diets, then they're going to need a protein supplement. We suggest that people don't do this. The amount of protein, as I said earlier, that you need is somewhere around 5.5% of your total calories from protein. The perfect human food for childhood would be considered breast milk. It has around 6% of its calories from protein, human breast milk, that is. So that's where your target should be. A plant-based diet, a whole food plant-based diet, provides around 10 to 12% of its calories from protein. That's where you want to be in terms of your protein intake. And more is not better, because again, as you get up around 15 to 17% of your calories from protein, that's when in population studies it shows that the risk of chronic disease, including cardiovascular disease and cancer, starts to go up. So too much protein is harmful to the human body. I see a lot of patients who come to me having seen other health practitioners who have sold them and encouraged them to take a plethora of vitamin supplements and minerals. And they ask me point blank, is this a waste of money? Am I being ripped off? Is this necessary? What I encourage patients to do then is, if they have another health practitioner who's pushing a particular supplement, ask the health practitioner to show you a scientific study done on human beings with hard outcomes. Hard outcome meaning heart attack or death, something that is not interpretable. Show me a study that shows that treating with a vitamin supplement and so forth will actually change outcomes. And usually the conversation after that question is posed to most of these alternative health practitioners, the conversation takes a sudden stop, because there's no science to show that supplementation for the most part has any change in outcome. And in fact, the Cochrane database, which is a large independent group of thousands of scientists who collect the data and independently review them, have estimated that for every 100,000 people who take vitamin supplements, there's a predicted estimate of about 9,000 of excess deaths in those group of people. So the risk is not only that you're going to lose your money, that taking vitamins and supplements in supranormal levels, so levels of vitamins that don't normally occur in the human body, maybe 1,000 times what it normally occurs in the human body, as you might expect, when you take those levels of vitamins in the human body, they probably disrupt the natural regulation of the human body and has harmful effects, let alone no benefit at all. So I just encourage people to be quite skeptical about anybody who pushes a ton of supplements and minerals on a person. If you're eating a whole food plant-based diet, a healthy, balanced diet, you should, for the most part, get all the vitamins and minerals you need for your dietary approach. John McDougall, who's been a clinician in this area for over 50 years, does recommend, somewhat just in case, for you to take a B12 supplement if you're completely whole food plant-based for more than 6 months. And the amount of B12 that you need is very small, something like 5 micrograms a day. Most supplements available on the market, I think the smallest supplement I'm aware of has about 100 micrograms a day. So if you took a 100 microgram tablet and split it 4 ways and took a piece of that every day or every second day, that would more than meet your vitamin B12 requirements. Otherwise, in terms of supplementation, again, any practitioner who recommends a supplementation, ask them a couple of simple questions. Where's the science to show that me taking a supplement to treat a supposed vitamin deficiency is going to make any difference in my particular health? And I'd be interested to see it because I'm unaware of any of the science that would support the use of these supplements.